COVID-19 vaccines were developed with remarkable speed, but the gap in getting the jab in everyone's arms is intolerably long. Europeans are facing the challenge with open divisions over who gets the vaccine and when. London has set September as the deadline to inject every adult. Having targeted elderly age groups, officials are now considering pushing key workers such as teachers, police officers and shop workers to the top of the queue. Within the EU, the timelines are already longer. That is causing some resentment of the quick start from the UK. The Germans, French in particular, are complaining the EU hasn't bought enough doses. Other countries are worried regulators haven't approved the fast rollout Oxford AstraZeneca vaccine. Disputes over failures to distribute the vaccine have erupted in a handful of countries. Tensions over how to prioritise different segments of the population are only set to grow after the vaccine is pushed out to the working age population. Tour companies are already noting higher holiday bookings by the over 50s in the second half of the year. Governments can try to keep tiered restrictions in place for as long as possible. Increasingly, the lockdowns could fray as the vaccinated step out to reclaim lost lifestyles.
After being hit hard by the pandemic, the UK is now one of the leading countries in terms of its vaccination drive. So far, more than 3.8 million people have received their first dose, with the government targeting 32 million by the spring. That's equivalent to 60% of the population. While 140 people are now being injected every minute, health service chiefs warn that 2 people are also admitted to hospital over the same time period. Infection rates still sit at about 40,000 a day, while the death toll topped 1,000 almost every day last week. The next stage will focus on the over 70s and those considered extremely vulnerable, with 4.6 million people set to receive appointments. While the vaccine is distributed from a number of large hubs, it is also available from community village halls and sports grounds, with 24/7 vaccine centres now being considered. With the rollout now speeding up, the lockdown could potentially be eased as early as March.
It's now a race to get the vaccine out in the shortest possible time before coronavirus mutates into a deadly and more virulent strain. The appearance of the new Brazilian form of COVID-19 suggests not only is the virus changing, but it now potentially reinfects people who've had the original strain. With the South African and British mutations growing more virulent than original COVID, governments are stepping up their vaccination programs, with 24 million people now inoculated in Europe and America. But that is half of what has been given to the rest of the globe, with some poorer countries yet to start giving out jabs. The economic reality is that 85% of Pfizer's vaccine and all of Moderna's has been bought by the highest income countries. Scientists believe there's a real risk that if parts of the world are left behind, that could well come back to haunt the developed part of the globe. It is now a race to get ahead of the emerging COVID variants, because the virus cannot be allowed to advance in one country, evolving into a new strain that might not be killed off by today's vaccine.